So my name is Lisa, and I am the community liaison for First Call Home Health and Hospice. We are the only currently locally owned and family operated agency in the state, and we are actually the second largest agency. And my partner in crime here is Amy. She's one of my fantastic LPNs. I am not clinical, so she's here to answer any of your clinical questions, but to also keep me honest if there's anything in my presentation that might be incorrect or needs some clarification. So, are we ready to go? So there are a lot of chronic diseases that you guys see. I only picked kind of the big three, so COPD, CHF, and diabetes. %80 of older adults, and when I refer to older adults, that's generally 65 and older, 80% of them have at least one of those chronic illnesses. 77 have at least two. There's 4 chronic diseases on there. Let me get my notes instead of trying to read it off that screen. Heart disease, cancer, stroke, and diabetes cause about 2/3 of all deaths each year. Chronic disease accounts for about 75% of our annual healthcare expenditures nationwide. Unfortunately, only 1% is spent on healthcare prevention. So we see a lot of, diabetes is 27%. Heart failure 14, and COPD is 11. So as far as an overview of COPD, a lot of this isn't necessarily new, but COPD is just an airflow obstruction, breathing difficulties, shortness of breath, chronic cough, and fatigue are probably the most common symptoms. Exacerbations can occur that lead to increased care needs and care costs. It can also lead to respiratory infections and further complications. And it is a progressive condition. There is no cure. There's only ways to manage it. Smoking is, I think, obviously the most common cause, but repeated lung infections as a child can lead to COPD in adulthood. Occupational dust and chemicals. Indoor smoke from either wood or coal burning stoves. And there are some genetic reasons. Who remembers the fires that consumed the canyon a few years ago? That was horrific for people with COPD.
When you say the canyon, what canyon are you referring to?
Up in Lyons, Detroit Lake, that area. So how COPD impacts daily life for your residents, the biggest thing is it's going to limit their physical activity, but that can also lead to social isolation and loneliness, which then leads to depression, and none of those are good things. An increased reliance on caregivers, difficulty performing household chores, challenges leaving the home, and increased fatigue. When we talk about helpful habits or management strategies, keep in mind that these are fairly generic, and I would not encourage you to make any of these changes with any of your residents without guidance from your resident care coordinators or from their primary care physician. So that's my cover my buns. Some of the helpful habits: quit or avoid smoking. Make sure they're actually following the directions that their doctor has given them. Practicing breathing exercises that can help improve overall lung function. Avoiding pollutants or allergens. There's usually a quality of air index, especially during the summertime. Get vaccinated against pneumonia and the flu. And again, this is one that falls under the get guidance from their primary care physician about staying hydrated. That can help to thin mucus and improve breathing, but if they also have CHF, increasing fluids might be a bad thing. And then while I'm going over this one, Amy has a handout. It's the red, yellow, and green. So how many of you are familiar with those sheets? Green, you're good. Yellow, you might need to go see your doctor. Red, you should probably go to the emergency room like yesterday. So while COPD is chronic and a progressive condition, there are several lifestyle changes that can help manage symptoms and improve their overall quality of life. The first one being to quit smoking. Quit smoking, vaping, anything where you are intaking stuff into your lungs. Medication management. There are medications such as bronchodilators and corticosteroids that can help. It's super important that they take these medications as prescribed. When it comes to home health services, medication management is considered a skilled need. And then pulmonary rehabilitation programs are designed to just really help overall support of lung function. Oxygen therapy is another one that can help alleviate symptoms. Staying active is super important. Eating a well-balanced diet is essential for maintaining a healthy weight. A heavy person with COPD is just taxing themselves more than if they were at a healthier weight. Avoiding those environmental triggers. Living with COPD can be emotionally challenging, so managing stress and anxiety, especially. I have worked in a building, and one of my residents, even though she was just across the street in her car, her battery had died and her portable oxygen tank, she was terrified that it was going to run out and that she was not going to be able to breathe. Fortunately, my daughter was in the area and went and saved her. But that's a very real concern, and why they, folks with COPD don't do a lot of the things that they would like to be doing. And then it's really important to have regular checkups. And then a support system is helpful as well. These are the different stages of COPD. Stage 1, that's when, you know, it might not be showing any symptoms, but your doctor is likely able to catch that. And that's probably the one stage where patients can take steps to improve their care. Stage 2 is a lot more moderate. There's still about 50 to 80% of lung function. Home care aids can be really helpful with grocery shopping, helping with meal preparation, and helping patients stay active and get the exercise that they need. Stage 3 is about 30 to 50% of normal lung function. So now we're starting to get into the serious, likely oxygen dependent stage. And home health skilled nursing can provide education and management for some of those COPD signs. PT and physical therapy and occupational therapy can help with energy conservation and endurance. And by the time they get to stage 4, that's considered pretty serious. They've only got about 30% of their lung capacity, and that's likely the stage where their primary care provider is having discussions about palliative care or hospice. So, CHF. This affects 14% of adults over the age of 80. It is the leading cause of hospital stays. 20% of those folks that go to the hospital go back within 30 days. Up to half of them go back again within 6 months. So heart failure affects more than 6 million Americans. The rate between men and women is actually about equal. It's one of those that people don't talk about because they fear the inevitable and they don't think there's anything that can be done. And I'm on a personal mission to change that belief. So there's systolic heart failure where the heart can't pump or squeeze enough blood throughout the rest of the body. And then there's diastolic heart failure where the heart can't, the heart itself doesn't get filled with enough blood. There's shortness of breath, edema, fatigue, irregular heartbeat, persistent coughing or wheezing. I think a lot of times that wheezing is from fluid on the lungs, and confusion. CHF is it really does require frequent medical monitoring. So if you have a resident that has congestive heart failure, those would be my number one recommendation. If there's nobody else you think of that would benefit from home health, these folks, the improvement in their quality of life will be substantial. The top 6 symptoms we already talked about. A lot of the swelling would be in the lower extremities. Along with the cough and wheezing, there will be a white or a pink tinged mucus. And then not just difficulty with confusion, but difficulty concentrating. So in a lot of senior living communities, I think we get nervous when our folks with dementia are still driving. I would caution that anybody with any of these diseases should probably not be driving because they're not driving safely. The impact on daily life, they can have difficulty with their activities of daily living. Heavy duty home care can help support that. They often have a restricted diet. They're becoming increasingly dependent. They're limited on their social activities. They're going to the doctor a lot. And they can't eat a lot of the things that they would really love to be eating. Following a heart-healthy, low-sodium diet is probably one of the top helpful habits that folks can follow. Particularly reducing sodium, controlling fluid retention, can help manage those CHF symptoms. Taking medications prescribed and on time. Again, what did we just talk about on the last slide? CHF can lead to confusion. So medication management is important. Coming up with a system where they're taking their meds properly and in a timely manner. Engaging in light physical activity, again, is recommended by a doctor. Our physical therapists are very familiar with the disease processes that we're talking about, and they know what type of programs to suggest that are going to be the most beneficial and appropriate for your residents. Limit fluid intake, again, based on medical advice. And then it can be very helpful if someone is able to attend those checkups with their healthcare provider. Medications like diuretics and beta blockers can help manage the symptoms. Again, folks with CHF really need home health because what's going to happen when they take those diuretics? They're getting up and going to the bathroom in the middle of the night. So our occupational therapist can help create a safety plan to get them from point A to point B without falling on their face. It's super important that they're self-monitoring weight and symptoms. And again, that's something our skilled nurses can help with reviewing. And if they identify any trends that are concerning, they can report those back to your RCCs and to their primary care provider. Cardiac rehabilitation programs can enhance their quality of life and reduce those rehospitalizations that we talked about. Conditions such as hypertension, diabetes, sleep apnea, those need to be controlled. So that's part of why we picked these three, is it's really super common that someone will have one or both, if not all three, to some degree or another. And it's patient education is another part of home health that can be beneficial because it teaches patients to recognize their symptoms of worsening heart failure, such as increased shortness of breath, fatigue, or swelling, and when to seek medical attention. So Amy has those red, yellow, and green sheets for CHF. Stage 1, that's really, an individual is at high risk of developing CHF, but there's not really any symptoms yet. So the focus at that stage is on prevention and risk management. Stage 2, there's some structural heart disease, but still there may not be any symptoms. So the focus for interventions would be on slowing the disease process. Lifestyle coaching and preventive education can be helpful at stage 2. Stage 3, there is structural disease with symptoms. And the focus on there is going to be symptom management and doing what we can to improve quality of life. Physical therapy can assist with mobility and maintaining strength, where skilled nursing can support care coordination, medication management, monitoring weight, and fluid intake and output. And then stage 4, that is the advanced disease with severe symptoms. The focus at that point is going to be on comfort and palliative care. Okay, diabetes. These slides, there's one for type 2 and one for type 1. Type 1 is when the immune system attacks the insulin-producing cells in the body, in the pancreas, leading to little or no insulin production. About 5% of the population has that one. Type 2 diabetes is when the body becomes resistant to insulin and the pancreas may not produce enough to meet the body's needs. Does that sound right to everybody? Okay. High blood sugar levels over time can lead to some serious health complications, but just more everyday symptoms include frequent urination, excessive thirst, fatigue, vision issues. Older adults are particularly vulnerable to neuropathy and kidney disease. I worked in a dialysis clinic for about 5 minutes. I hated it, so that's why it was only 5 minutes. But I could go around the room and every other person either had diabetes or high blood pressure. Diabetes increases the risk of cardiovascular disease, including heart attacks and strokes. And managing blood sugar can be challenging due to the age-related factors like reduced mobility, cognitive decline, and multiple chronic conditions. So, type 1 versus type 2. 90 to 95% of the people with diabetes have type 2. It becomes most common over 84 years of age, where type 1 can hit you anytime. It used to be referred to as juvenile diabetes, but it doesn't just affect kids. Type 1, you are insulin dependent. Type 2, you might need insulin. Can you guys see that? I'm just going to give you a minute to look at it so I don't have to read it to you. If anyone could just nod when you're done reading it. How diabetes impacts daily life. Managing blood sugar levels can require a lot of lifestyle changes. There's a risk of hypoglycemia, vision impairment, and neuropathy. Again, this disease requires frequent visits to a doctor. And the medication schedules can really do a number on people's daily routines. And all those things can impact their quality of life. Helpful habits. I think all of these say something about eating a healthy diet, and I obviously don't follow that. Limit alcohol, carbohydrates, and sugar. Exercise for 30 minutes, 5 days a week. Even if your residents can only do 10 minutes, 3 days a week, any amount of getting their body moving on a regular schedule is going to help them. If it's pre-diabetes, safely change your diet, and that might be all you need to do. Monitor blood sugar regularly. I included this plate because I think there can be a lot of confusion over what a diabetic can or cannot eat. Small amounts of fresh fruit. Lean protein is a huge piece of that. Non-starchy vegetables are really big. A whole grain or a starchy vegetable like corn, potatoes are bad. And drinking skim milk or 1% milk. The number one way these diseases are managed is through insulin therapy or oral medications. Emphasis is really on healthy eating and monitoring blood glucose levels. Regular eye, foot, and kidney screenings. It's very common for diabetics to end up with wounds on their feet that then require skilled nursing. Because of the neuropathy, they don't feel it, and because of the diabetes, it doesn't heal. Stay hydrated to support overall health. Again, check with their doctor. Getting enough sleep can help improve insulin sensitivity. And managing stress, believe it or not, can help regulate blood sugar. So for type 1, education and training is really key. They really need to know how to manage those blood glucose levels, because again, they are insulin dependent. And then educating them on understanding and recognizing the signs of hypoglycemia or hyperglycemia. Medication management, helping assisting with administering insulin, monitoring proper dosage, and ensuring adherence to prescribed regimens. Performing regular blood glucose testing and tracking can help identify patterns or trends that are the wrong way. The 5 stages of type 2 diabetes. At stage 1, that's where they're starting to develop insulin resistance. Type 2 is prediabetes, and then formal diagnosis. Stage 4 is when the complications begin. Stage 5 is that's pretty advanced diabetes complications, like losing feet and legs and toes and fingers. Fun things that we don't want to see for anybody. Lifestyle coaching can really help with helping patients in making sustainable changes to their diet and exercise and weight management. Medication support with glucose monitoring, working with them on preventing complications. They really need to know what those early signs are of a complication before the complication gets really bad. And then just teaching patients about the progression of diabetes, strategies for managing their stress, and recognizing the symptoms of hypo and hyperglycemia to promote self-care. I think the more you can encourage your residents to be involved in their healthcare decisions, even if you're the one guiding them, if they feel like they are actively participating, you'll see more adherence to what they should be doing. Because I know I have yet to meet a 75-year-old that wants to be told what to do. So that's it for you guys having to listen to me stand up here and yap at you. But I still have another 30 minutes for you.
I just wanted to point out too, it's, diabetes type 2 is very curable in the first and second stage. So that's the most important time where, we still can control that. So super important that we learn about diet and exercise and, that we teach everyone that. And there's lots of resources too. American Cancer Society has, or American, cardiac, all that, they have mitten, diuretic training and lots of information online. So make sure you pass that along. It's very curable.
Is anyone in here a medical doctor? Okay, then I know y'all have questions. Because unless you went to medical school, there's got to be something you don't know or something I shared that you want to challenge or that you want more information on. Yes, ma'am. Stop me when I get to the one that was on. I'm sorry?
It was kind of towards the beginning. Oh, yeah. Well, kind of. Yeah, that one. It takes a quick breath.
Let's ask Dr. Google. Unless you know the answer.
Well, I do believe, so all of us tend to be very vitamin D deficient, so it gives us energy. And so I don't know exactly the role for specific vitamin D, but all of us should be pretty much taking it, especially in Oregon. But the specifics for COPD, I don't know if it's lung function too.
Yeah, so it's pretty generic, but it says it can improve lung function, reduce the amount of sputum produced, and that it helps keep bones and muscles healthy, which can help with building strength and being active, and it reduces the risk of acute respiratory infections. See, even I learned something. I didn't know that. You had a question?
Mine is about type 2 diabetes. It's maybe your last slide.
Okay.
So, that's,
This one?
so I've never heard of stage 1. And how does a person find out that you have insulin resistance? Is that a normal blood test?
It's a fasting lab.
Say it includes
It's a fasting lab that you would do.
fasting blood. Okay. Are they doing it on people our age or like
Anybody's age.
anybody?
And your A1C, so that A1C, it averages out more like glucose, which is just your daily glucose level. It's also should check it in the morning, excuse me, because then that way we know exactly how much insulin you have. So when you wake up in the morning, that's truly not how much you've eaten, it's what your body has taken and taken away.
So, yes, the fasting plasma glucose, whoever said that, A1C testing, symptoms that may indicate insulin resistance are similar to what someone experiences with diabetes, but if unexplained fatigue, difficulty concentrating, more frequent peeing, increased thirst. So if you've not been diagnosed with diabetes and you start to experience some of those, probably not a bad idea to have a conversation with your doctor. Who else? Y'all, I got 20 minutes. Don't make me torture you. Anyone? Bueller? Bueller? Yes.
So, COPD,
Yes.
it says, at all times avoid inhaled air. What's your opinion about like perfume?
I was just gonna say an inhaled irritant, perfume,
And it was like
hairspray, air freshener,
that.
any of that smelly stuff. But particularly if it's something that's putting particulate into the air.
Even regular roll-on deodorant can activate it.
Yes, it can. That's why I normally have really bad PO by 5 o'clock. I'm kidding.
I had a neighbor with COPD and she, sometimes we'll invite her to take a walk and she says she can't because she has COPD, but this is helpful now, I understand. She doesn't have full lung function.
Correct.
It would just be hard.
We're seeing a lot of rise in people with COPD that have never smoked too. So it's pollution, it's things in our home, so, trying to eliminate those things that are just, you want a better smell, making sure you realize that the chemicals, could be harmful.
Candles may smell good, but they are so incredibly bad for you. So if you like things that make your house smell pretty and yummy smelling, pure essential oils are far better. Don't buy the stuff that you get at Walmart because that is heavily perfumed. But to go back to what Amy just said, on my drive out here, I saw a Facebook post from one of my rescue partners. She's in her mid-30s, never smoked, and she was just diagnosed with a rather uncommon lung cancer, and she has to have 20% of her lower left lung removed because she has a tumor the size of an orange. Christopher Reeves' wife died from lung cancer, and she was never a smoker. Betsy, is there anything that you would like us to go in more in depth?
Not that I know of, unless anybody has any more questions.
Okay.
Alicia, do you have anything?
has questions about home health? So home health is different than home care. Home care is what you'll hear referred to as private duty or companion care. That's what people are paying out of pocket for. Home health is a Medicare covered benefit. So really any of your residents that have any type of medical condition should be receiving home health because it's just another set of eyes, additional support. Is Friendsview, are you guys 100% fully staffed? You are? Throughout the campus, you're 100% fully staffed? No?
No, we use agency.
Okay. Well, having additional clinical folks like Amy in can help with that burden. So there's 5 different skilled services that are covered under home health, no matter what the agency is. So this isn't a first call commercial, it's just educating you on home health. Skilled nursing, physical therapy, occupational therapy. I didn't know this until a couple years ago. Occupational therapy can actually help with confusion and cognitive training. Medical social worker and speech. The one criteria where your residents, particularly those in independent living where they may not qualify for home health, Medicare has what's called homebound guidelines. Who knows what that is? In order to qualify for home health and have Medicare pay for it, their absences away from home need to be infrequent and limited duration, have a taxing effort, and require some type of assistance. Even if that assistance is leaning on somebody else or using a cane, a walker. So that's about 80% of the population that's over the age of 75.
Do you all work in Newburgh?
We do. Amy, where do you live?
Sheridan,
Do you know where Carmen lives?
Debbie.
And then one of my physical therapists, Krista, I think she lives in Minville. My other physical therapist lives in West Salem. And all those people that I just did are dedicated to Yamhill County. Did I bore you guys to death? Was this helpful? Terrible? You never want me to come back? I'm seeing a couple of thumbs up. If you were, I hate microphones.
Probably need to back away from it.
Yeah, if you were to invite me back, is there a topic all of you would be interested in learning about? Oh, come on, what are some of your biggest challenges?
I'd say like how to support residents with dementia.
Awesome, I've been an educator for the Alzheimer's Association for 8 years. I'm good at that one. So, caregiver care. Okay? Now, understand I don't have the power to make these decisions. But if somebody were to invite me back, I could absolutely do those topics. What else? What are some of the biggest challenges you guys are seeing among your residents?
Managing stress and anxiety.
How's that? What does that look like?
Oh gosh. I mean, I feel like everybody suffers from it to some degree, but how to deal with your own stress and anxiety, their stress and anxiety without making it worse, because sometimes I see people like myself, I get anxious really easily and very social
Some of the anxiety you mentioned as far as their medications or their disease state, those are absolutely folks I want you to talk to Betsy and your other care team about the appropriateness of home health. I'm not gonna stand up here and direct you guys to do anything because you don't work for me or with me. But something else to keep in mind, Betsy, this is something I put out there for everyone. I'm halfway through getting my master's degree in psychology, but with an emphasis in life coaching. Serving the older population is absolutely my passion, and I've been known to have conversations with some of those folks. I'm not a counselor, I'm not a therapist, but sometimes just having a conversation and asking them questions and helping them see what they're anxious about from a different perspective can help in those situations. So Betsy knows how to find me if you ever think there's someone like that would benefit. That's just my mouse.
Do we have any other questions or concerns or anything about the topics we've heard today? So I want to thank First Call
Home Health and Hospice.
for coming in today and sharing this information with us.